worst stretches for low back pain and what to do instead, featuring Dr. Stu McGill, who's an expert with Jeremy Ethier. This has 5.7 million views. We're going to watch it. I'm a practicing clinician now for 15 years. My name is Dr. John Sobolski, and I'm familiar with Jeremy, and I'm familiar with Dr. Ethier, or with Dr. McGill, but they usually tend to explain things on a very simple level, and oftentimes it's not enough to get the job done. So if you're looking for some good information and then maybe a little bit deeper knowledge, stay tuned. I'm going to break this video down. Let's watch it.
One of the first solutions people struggling with back pain seek are lower back stretches to relieve their pain. But the truth is, many of these stretches are just short-term fixes that actually end up doing more harm than good, and are the opposite of what people should be doing to adapt changes that permanently eliminate their back pain. For example, common stretches like toe touches, pulling your knees to your chest, and other similar stretches, they trigger what's called a stretch reflex, which is a neurological phenomenon that temporarily reduces pain sensitivity. Meaning that after you perform these stretches, you'll often experience about 15 to 20 minutes of pain relief, which many would obviously perceive as beneficial. But the problem is that in putting your spine in these flex positions, you end up re-aggravating your discs, and after you've experienced temporary relief, the pain will return much often worse than before.
Okay, real quick, two things. We're talking about neurology, we're talking about spinal flexion. Stu McGill is infamous for being against spinal flexion. If you've ever watched like Squat U, University, Aaron's videos, then you know how dangerous spinal flexion is. It's not dangerous, it's just the most common position that people's low back pain is triggered. And so in that sense, yes, you need to avoid spinal flexion, but in the long term, once you're healthy, you need to actually strengthen spinal flexion. So don't be afraid to flex your spine. This happens, I've seen many patients come in, they're like, I can't bend my spine ever or my discs will pop. Absolutely untrue. In the beginning stages, perhaps, of rehab, you need to adjust your idea of spinal flexion and maybe work on something else. I think we'll talk about that in a second. Could be wrong. But then in the end of it, you need to be able to move your spine. But we'll get more into that here in a second. Oh, and then neurology, the neurology of it. When he's talking about neurology, he's not a neurologist. Jeremy is like a personal trainer. Stu McGill is a researcher, also not a clinician. But they do not have a neurological standpoint. I'll kind of give you a neurological standpoint in a second of this, but we'll talk about it more here in a second. Hold on, we'll get into it.
Which just creates a vicious cycle of thinking that these stretches are doing good and are the only solution for relief, yet in reality are just contributing to the pain. The key is to break this cycle. If those stretches cured you, then you wouldn't be watching this video. So instead of focusing your energy on stretches that bend the spine, focus your effort on movements and stretches for other parts of the body that can actually aid you on your road to being pain-free rather than make the pain worse. And within this video, with the help of Dr. Stu McGill, one of the most respected, experienced, and knowledgeable experts in the world on treating back pain, we'll share 4 such moves that can help do just that.
So to just start out our mobilizing routine, what would be the first move that you'd recommend?
Well, based on the findings of our research where we assessed the stresses in the spinal discs, we found the cat and camel was the very best way to reduce the friction in the spine and prepare the person to move. The position for beginning the cat camel is on all fours. Knees are under the hips, hands are over the shoulders. Most people need to spread their knees a little bit apart to free the hips. So the move is full spinal flexion, including the ball and socket joints of the hip and shoulders, and full spinal extension.
Also, you want to avoid pushing the end of each range, as this is not a stretch and it's a simple movement of the spine that's most important. Now, Hold
on. Movement to end range is where the most change. End range equals change. If you do not improve your end range of motion, you don't improve the overall range of motion. If you just improve the middle ranges of motion, you don't. That's where most people live, is the middle range of motion. It's usually at the end range of either side where the most improvement happens. So I'm not saying strike one, but end range is good. End range is healthy.
Stu McGill measured spine stress on patients performing this movement, and he found that only 7 to 8 cycles were all that was needed to help reduce spine friction and resistance. And in fact, he found that further cycles could even undo the value of this exercise.
As we measured people performing the cat-camel back and forth, we measured the reduction in friction, or the gooiness of the joint, if you want to consider it that. And within each cycle, the person reduces that friction and they asymptote, meaning that they don't remove any more friction after 7 or 8 cycles. So that's all you need. More cycles is not better.
Okay, so real quickly about more cycles is not better. You also need to understand that when Stu McGill is talking about this, he's also talking about the disc itself. He's not talking about the structure, he's not talking about the muscles, he's not talking about the connective tissue, he's not talking about the ligaments, he's not talking about a number of other things. He is solely focused on the disc, and the disc is very important. However, especially if you're really deconditioned, if you're not very strong and you've never really done cat-cows, it does make sense that, okay, don't be doing cat-cows a bunch. In the beginning it can feel good, but you can do cat-cows repetitively. There's a lot of variations that we do on Stretch Club all the time, every week. A lot of different variations where you put one knee in front of the other, one hand, you twist your spine a little bit. You can still do cat-cows and get the benefit from them. Really, the part where it gets bad is if you lose touch between the mind and body connection. If you're doing cat-camels and you notice and you feel that you're not getting better, that you're starting to get weak, you just need to, every exercise should connect you a little bit more deeply with your body. But you can definitely do more than 7 to 8 cycles. Again, this is one of those things where it can cause some fear in patients, and I've seen this in my clinic. You can do more. It's really about being in touch with your body, which is not difficult. You can do that.
Once you've done 6 or 7, so that's the warm-up recommendation.
So stick with that recommendation and avoid overdoing it. After completing the cat-camel and reducing a bit of the friction in the spine, we're now ready to move on to some mobilization drills for other problematic areas within the body that may be contributing to your back pain. The first drill will target one of our major hip flexor muscles, the psoas. Although this muscle is already pretty tight in most individuals due to prolonged sitting, which puts this muscle in a shortened position, much of Dr. McGill's EMG research showed that back pain actually tends to tighten this muscle even further, which is problematic because, as you can see here, the psoas attaches to the lumbar spine. So
one thing really quickly about EMG research is that EMG only tests the contractile forces of a muscle. It doesn't test the elongation or the eccentric portion of the muscle. So EMG studies are nice to know about, but again, they only give kind of a smaller part of the picture. And he's about to talk about the anatomy of this psoas, and maybe we'll expand on what more of the anatomy you need to understand. But let's go on, let's see what they have to say.
When this muscle becomes tightened, it can actually pull your pelvis forward and down into an anteriorly tilted position, which can increase the compressive force on your lower back and just worsen the pain that you might be experiencing. Stretching this muscle and taking it out of the shortened position it's in all day can therefore help provide some relief to that lower back tension.
Okay, so you also know that there is a trend going on on TikTok and YouTube or Instagram for a couple of years now where there's an audio that goes, strengthen your damn hip flexors. Strengthening is also important. So yes, usually though, the first step is to stretch. It often doesn't, if you can't stretch it, usually stretching helps the strengthening portion. So you should usually do what he's saying here and stretch it first. And there are a lot of different variations to stretch it. We'll see which one they're gonna show us here next, but there are also numerous ways to strengthen it. So you want length, then you want strength, and then you want the ability to move back and forth between a stretched and a long position. So just a bigger picture how to think about the psoas, but let's get into the anatomy more in a second.
However, Dr. Stu McGill's research has shown that your standard hip flexor stretch will not access this muscle due to its unique anatomy. Instead, there's a unique move that we can do that helps to specifically stretch this muscle.
So I also know that based on your research, you found that the traditional hip flexor stretch, it just doesn't really target the psoas very well. Instead, there's actually a special stretch that you recommend. Can you briefly just take us through how to perform it?
Well, Jeremy, as we've discussed in the past, the traditional lunge stretches the hip flexors. It's true, but it doesn't target the psoas. The psoas is a very special hip flexor in that anatomically it travels up the lateral spine to the level of the diaphragm. And if I adopt the lunge position, I feel general hip flexor stress, but it's not the psoas. But when I raise my hand up very strictly over my head and push and lean my shoulder into the forward leg, and I drop the shoulder back, all of a sudden I feel that psoas tendon become tight. And now for the first time, I'm getting a true psoas stretch. And I'll hold.
Okay, so I don't know if he's talking about the stretching the psoas tendon. The tendon is what connects down into the bone of it. Let's see if we can get some anatomy here of it again. We're going to go over the anatomy of the psoas again? No, let's go back to the anatomy of the psoas and talk about where. So if he's talking about stretching here we go. Here's where the psoas lives, right? So you heard him say that it goes into the diaphragm. The diaphragm goes up into the bottom of the rib cage. So the diaphragm also, the diaphragm on the right is bigger than the diaphragm on your left. You have the right side of your torso is actually bigger than the left because you have a liver on your right, you only have your guts kind of on the left, you have your heart on your left, which also makes the lungs smaller on your left, so you have a bigger lung and a liver on your right, which makes the right diaphragm a little bit bigger, so the connection of the psoas on the right is also a little bit bigger. Now, so you have 4 places to release the psoas. Some people say you can't even release the psoas unless you release all 4 of these bits. And if we're just stretching the tendon, that's fine, that's a good place to stretch, but the top one would be your diaphragm, the psoas and the diaphragm. The second would be the psoas and the spine. The third one would be the psoas kind of where it loops in here with the hip. Like you can see it kind of connects and kind of cups down here. It actually connects to the side a little further out. The iliopsoas is also very much entwined with your psoas major, your psoas proper. And then the last one is down here into the tendon. The tendon is super important to stretch, but there are also stretches for each one of these specific areas. I guess comment below if you want me to kind of go over each one of the various different psoas stretches. We do some of these on Stretch Club every week also, but like this is not a bad stretch. Let's kind of hold on. Let's see what was the sequence that he's talking about. Let's go over that again.
Adopt the lunge position. I feel general hip flexor stress, but it's not the psoas.
Yeah, sometimes also people will feel their quad stretching with this, and that's okay. Knees over toes guy, my friend Ben, has a good hip flexor stretch, and a lot of people when they do Ben stretch, they feel it in their quads, the front of their thigh, and that's fine. Sometimes you have really tight quads, you can't really get to your hip flexor until you stretch your quads thoroughly. So if you are stretching your hip flexor and you feel your quads, that's fine. Let your quads burn out. You kind of got to get through the quads almost sometimes to get to the hip flexor. But hold on, let's see what else he's got here. So,
but when I raise my hand up very strictly over my head and push and lean my shoulder into the forward leg, and I drop the shoulder back, all of a sudden I feel that psoas tendon become tight. And now for the first time, I'm getting a true psoas stretch, and I'll hold that
because you're getting from the diaphragm all the way down. It makes perfect sense. This is a great idea.
for 2 or 3 seconds, and then I'll lunge, go to the other side. I can feel the softness in the tendon, push my arm up with effort, very strictly, drop the shoulder back, and now I can really feel the psoas stretch for the first time.
2 other things I would say with this when you're doing this overhead reach is take a big breath in, because that will also kind of lift up your diaphragm as you inhale. You'll feel that. The other thing is to almost tuck your pelvis forward, so like push your pubic bone, the bone on the very bottom of your hips, kind of tuck your hips forward. That'll also get you a deeper stretch as well.
Softness in the tendon, push my arm up with effort, very strictly, drop the shoulder back, and now I can really feel the psoas stretch for the first time. And I will go through 6 cycles per side and really enjoy the newfound mobility.
Yeah, and you can do more than
Next,
6 cycles. 6 cycles is great. I mean, you could do, I literally will lunge, 50 yards and do this left, right. Some of the repetition really does help to break the cycle. Okay, so next.
we want to move on to a drill that will help us further mobilize and open up the hips while strengthening some of the important hip muscles that tend to be weak and inhibited in those experiencing back pain.
Hold on, let's talk about inhibited really quick. A lot of people talk about inhibited mean like your muscles do not work. Inhibited, like when you drink and your social anxiety is inhibited, that makes plenty of sense. Inhibited doesn't mean your muscles are not working. Your muscles are always working. Trust me, there are people like, oh, I've got glute amnesia, my glutes just don't work. If you can stand and walk, your glutes are working, okay? It's just often they're not in a good position, or you've trained them to be not the primary mover. So if you're experiencing back pain, most likely, we've talked about kind of the sitting thing. When you sit, you kind of not turn your hips off, but what happens is your hips become sedentary and you start moving through your spine. Your spine is not a primary mover, but I think maybe we'll talk about this. I hope we talk about this.
It's important to do because Dr. McGill's research has shown that stiff and weak hips cause more motion to be transferred to the spine whenever we move or exercise.
Okay, so this is also the idea of the joint by joint complex. Okay, so in the body, each joint, there's a prime mover and there's a fine mover, we say, right? So like your hips are a big area of movement. Then your low back, there's not much protecting it there. There's a big joint complex with the hips. So the hips should be prime movers. These are big muscles, lots of joints here, SI, ilium, sacrum. But then your low back is just these 5 segments, and they're kind of like left all on their own. You have your core that's stabilized on the other side and some muscles on the left and right, like your QL. But then you have your rib cage here, which is 12 segments, plus this big barrel of bones around in your shoulders and your lats that kind of protect it. So the father of orthopedics, James Syriac, said if you ever have a problem, you need to check the joints above and below that area. So it makes a lot of sense that if your back is hurting, it often means that your hips are not doing enough, or your thoracic spine itself is also not moving as well as it can be and is placing too much stress on this low back. So you need to be able to open up your upper back, and you need to be able to open up and use primarily more your hips, or move primarily more through here. So if your hips get super stuck and your mid and upper back kind of get stuck, your low back will take on this extra stress of that load. That's kind of a little deeper understanding of what he's kind of talking about here.
Can therefore worsen the back pain that you're experiencing. To improve this, we're going to use a mobilization drill that's called hip airplanes. So for these, assume a single leg stance, brace your core, and grip the floor with your planted foot. Then place your hands on your hips and rotate your torso forward over your planted leg while kicking your back leg behind you. You want to keep the back leg completely straight and your planted leg knee in a slightly bent position. Next, rotate your hips in towards your planted leg and then transition to rotating it away from your planted leg.
Okay, so
A cue that may
he's trying to move through the hips and not through the spine. So teaching your body to stop moving primarily through the spine and teaching your body to move through the hips, that's kind of the main goal of this. So do what he's saying, but just remember that the goal is to stop moving through the spine and learn to move through that ball and socket joint of your hips. That's really what this is doing. He's doing a good job. I like this. So there are a lot of different exercises to do this. There's a lot of ways
to help
to do
out
this.
is to think about simply moving your belly button towards your planted leg and then away to the side. You want to rotate only as far in and out as you're capable of doing at the moment and build upon this range of motion over time as you improve.
I like to turn that back toe. See how his back toe is kind of going out like that as it goes up, and then when it goes down, point the back toe down as it goes down to get you a little extra motion. Also, you can turn your torso a little bit further down. There's one other thing
And you want the movement to come from your hips as opposed to simply twisting your upper body. So just
so see how he's pointing that toe down? You can point that inner toe down even further, honestly, and really focus on that internal rotation, so which really lengthens the glutes a lot. But there's one other
Be
thing.
mindful of that and aim for a total of 3 sets of 3 controlled reps with the movement. If needed, you can hold on to something for balance initially to get more familiar with the movement, but eventually the goal is to progress this to the full hip airplanes with the arms spread out straight to the sides in order to add another dimension of difficulty to the movement.
Okay, and let me add another dimension. Oftentimes people, and Jeremy's kind of doing
Movement.
it here,
So
you can kind of see, hold on, when he go back here, where are you doing it, Jeremy? Let's see the part where I
and you want the movement to come from your
so
hip.
one of the things here, yes, you do want the movement to come from the hips, but you can see how his low back is kind of extended. Sometimes if people's low backs are very dominant in their movement, you'll still feel this in your back. So it's actually okay to tuck your pelvis a little bit and round your back ever so slightly. You don't want a lot of rounding in your back, obviously, but if you round it just a little bit or tuck your hips just a little bit, tuck your pelvis down a little bit, you'll feel that you center your weight a little bit more through the hips, and then you can move back. Don't be afraid to round your back just a little bit, because if your back is extended as Jeremy's you can see this kind of arching in the back. A lot of people, especially if you have back pain, arching the back, tensing up the back is where your back will feel more protected. And we want you to get out of that just a little bit. So just slightly rounding your back, lengthening your back a little bit, or tucking your hips a little bit will help you get into your hips a little bit more. And that will be great. And there's a lot of easier ways to do this. If this is too hard for you, again, there are a lot of easier ways to do this. If you'd like to see those, maybe I'll make
As opposed to simply twisting your upper body. So just be mindful of in order to add another dimension of difficulty to the movement. So the last move is going to help with the daily upkeep of your back. Most of us sit for quite a bit throughout the day, and all of this sitting, especially when done in a poor posture, creates a lot of built-up stress on the discs in our back. This corrective drill here was designed by Dr. Stu McGill to help combat that stress from sitting that can often worsen our back discomfort.
People complain that sitting at the computer causes back pain, and as much as they try to sit upright, sooner or later, after an hour or so in front of the computer, they are sitting in this cashew-like position. The antidote, as we have measured it, is to stand up, and there is a stress that's been built up in the posterior part of the disc. Simply stand, put the hands behind the back and relax. And now we're going to measurably and progressively dispel that stress, putting the hands over the head and just allowing that to dissipate some of the posterior stress in the disc, and then put the hands as far back as possible, comfortably possible, and then fully and deeply inhale. Jacking the diaphragm up off the pelvic floor into full gentle extension, and then putting the arms down. And if we were to remeasure the stress that they had built up in their discs, it would be measurably dispelled.
And we see this seems kind of intuitive. I'm sure many of you have probably done this naturally yourself. This will give you obviously some relief in your upper back. But again, this is a very simple way. There are a lot of other ways to release your thoracic spine, thoracic rotation, lat inhibition. The thoracic spine is actually very complicated. There's a couple books on it that a bunch of Australian physios have written that I got really obsessed with a number of years ago. The thoracic spine can get complicated because you have the movement of the shoulder. You have people who move predominantly through their back, so the thoracic spine can get a little complicated. This is a simple one, and I'm sure many of you have intuitively kind of been like, yeah, that makes sense, I'm going to do this. You stand up in the morning, you probably do that, take a deep breath. Nothing wrong with this, but if this doesn't cure your back, just know that there are many other ways to work on your thoracic spine. If you'd like to see that, maybe comment below. I'll make a video.
By breaking up every 20 to 30 minutes of prolonged sitting with this drill, you'll be able to prevent an excessive buildup of stress on your lower.
And the idea of this is just breaking the habit, right? Like we have a habit of sitting too long, we have a habit, our body falls into the habit, and so all these stretches are helping you break the habit. So just know that the stretch is not magic. The stretch is helping you break a habit, and the real goal is to do the stretch enough such that it breaks the habit of you falling into the position that causes pain.
Lower back, and will be better able to prepare your back for each period of sitting. So, as a summary, if you're experiencing back pain, then try to replace the bad stretches that do more harm than good with these moves instead, and do them regularly. Ideally, you want to do these daily or even multiple times a day just to break up your sitting if you're quite sedentary and you sit throughout the day. If this helps alleviate your pain and discomfort, then that's a sign that you're on the right track, and it's an indication that you'll want to continue performing these stretches. At the same time though, just keep in mind that back pain is specific to you and your situation, and there isn't a general fix for everyone. Luckily, Dr. Stu McGill has created a book, A Back Mechanic, that guides you through a self-assessment and then teaches you a solution matched to your specific pain. I personally read through it and I would highly recommend it. One side of the pain, he also has other books that can help you then focus more on performance, and I'll just leave the links to his books in the description box down below. And for those of you who are looking,
right. So here's the big thing, right? Your body. We was talking about the neurological stuff with your body. Like, we really want to break the cycle of what is happening in your body, in your hip flexors, in your core, activating your hips, loosening up your thoracic spine. If you understood the concepts, then you could do a million other different exercises. These exercises are fine. There's nothing wrong with these exercises. There are a number of different variants to these exercises, but the idea of breaking the habit of these exercises really means you're introducing some sort of novelty. So you need to do these exercises and variations of these exercises, which is what we do in Stretch Club, link below if you would like to join. But we do different variations. You need to break the habit, which is novelty. It is consistency. You need to consider the joints above and below. You need to consider not just moving the disc. You need to consider, earlier he talked about the neurology of it, how the stretch reflex is a neurological response. And yes, it is. So, but one of the things, the deeper level of that is that you need to train your neurology. Yes, you're training your discs. Yes, you're training your muscles. Yes, you're training the soft tissue and joints and ligaments and all that stuff around. But really, you're training your brain. You're training your neurology. Your body falls into habits. That is the neurology that you go into. You have a habit of crossing your legs a certain way. You always lean to the right or lean to whatever you do. That is your neurological habit. And these stretches and exercises are neurologically retraining you. You need to do them till they become a habit. Sometimes some of these stretches, you'll be like, I'm not really feeling them, but it's the concept of the stretch, the releasing of the hip flexor, the moving through the hips, the opening up of the thoracic spine, the being able to move freely through the spine and restoring the elasticity of the spine. You need to find different variations to be able to do these. Again, like I said, in Stretch Club, we do this every week, different variations of all of these things. It's the underlying principle that I really want to get across to you here. If you can understand the underlying principle, you can get much further than just these three stretches will take you. And these three stretches can break a cycle of your back pain, no doubt. But again, there is no A to B. You have pain, do this, you'll be out of pain forever. Your body you're going to be dealing with your body for the rest of your life. And so if you really want to learn some of these principles and practice them on some deeper levels, that's why I've created Stretch Club. I've got a year's worth of a library. You can see there's a library for different body parts, and we do new stretches each week. I suggest you kind of just do each week, but if you want to work on a specific body part, you can work on that in the library. Otherwise, I hope you guys enjoyed this video and learned a little bit of something extra. And if you would love to hear your comments, and follow and smash that like button, baby. And we'll see you next time. Peace.